Welcome to Therapist Table Talk Newbie Therapy. This is Brandy Padarakis, and I want to talk about what actually works in the therapy room. We'll break down practical tools and helpful interventions. Whether you're fresh out of grad school or navigating your first few years in the field, this podcast is here to support you. Thanks for joining us in this season of Newbie Therapy. Welcome to Therapist Table Talk Newbie Therapy. It's our brand new episodes that we are starting, all centered around newbie therapists. And so we know that you coming into therapy and doing therapy as newbie therapists, that you're going to need a little bit of guidance and a little bit of help. And you may have great supervisors out there that is given this. This can be an addition to help out. And maybe you don't. And so therefore, this is also a resource that you can use to be able to work through some of those hard things that you're dealing with your clients, find some new strategies, some new ways to help all the people that we're trying to help. And so today's episode, I want to get in and dive in a little bit. Today's episode is really cool because we're going to talk about the components of becoming a social worker or becoming a therapist. So for those of you that are out there that are interested in becoming a therapist and you're like, newbie therapy, I want to be a therapist. Well, this is how you're going to be able to do that. So with me today, my name is Brandy Padarakis, and I'm the owner of Blue Bee Counseling Services alongside with Logan.
I'm Logan Goff. And yeah, we're both owners of Blue Bee Counseling, and we're super excited to be here to help you with, these resources, what you should expect in internships or look for, schooling, all the fun stuff, because it can feel so overwhelming, especially if you don't have those resources, especially if, your school counselor isn't responding to your emails or your supervisor isn't around. So we wanted to be here to give this as a resource to you so that you can not feel so alone.
Yeah, we don't want that. So here's the great gist of how to do it. Oh my gosh, my words today. I mean, seriously. Okay, so what we're going to go into is we're going to talk a little bit about what it takes to kind of be a therapist. And so what it does take is it takes you becoming an LCSW. So it's the pathway towards an LCSW. Yes. And so what does that look like? Well, that is really great. Logan, do you want to start on this? Because she actually did the first part of this. She started with going and getting her associates, working into her bachelor's. So tell us your kind of journey on this program that you've kind of done.
Yeah, so I got my associates, and I was actually aiming to get it under, I think there's a social worker option for my associates, and some of those classes would have applied for my bachelor's. However, when I talked to my school counselor, which I never did, I was that person, I'm like, I'll just figure it out. I'll just take the classes, and this is what it says online. But I talked to my counselor, and he was like, actually, you can graduate this semester. You can get your associates and then you can apply to the bachelor's program and then just be in your bachelor's program and get it done with. Because otherwise, I can't remember what it was called, but to get that social work addition on my associates, a lot of those classes wouldn't possibly even apply to the bachelor's program, and it would have I would have been in school for a year longer to get my associates, and so because of that, so that's
associates in social work,
and so yes, that whereas I just got my generals, but I still got accepted into the bachelor's program, I still because then otherwise I was planning on doing my bachelor's and completing my associates, because some programs do allow you to complete your associates in your first semester of your bachelor's.
Which was mine! So I was going to say that. I actually didn't graduate with an associate's when I got into my bachelor's program. I just had to have it done before I graduated.
Yeah.
I believe so. And so anyway, that was one of the things that was kind of cool, is some of those classes I got a double dip from. You know what I mean?
Yeah.
Which is, I started my bachelor's program, and that could work. Some of those classes could work for my associates, which ended up getting me to graduate.
Which I didn't even know that was even an option either until I talked to my school counselor and got on the schedule and did the whole call thing. Because, otherwise, you don't know.
Right.
You just think you have to get your associates, and then you have to then you apply to get
Right.
your bachelor's program. But like, little did I know that you could do it simultaneously. But also, I didn't even have to. I could have just graduated my generals and then got into like my bachelor's, which
Right.
is still associate's degree, and then
Yes.
got into then go into my bachelor's. And so that was an option I didn't even
Right.
realize and understand. So, but from there I got into my bachelor's, and I personally only did one semester. Realized I loved it so much, but I personally loved the marketing side and the business side of things, and so that's how we work as a co-ownership. Is she more handles with all of the social work, logistics, and I help with the marketing, with the admin, front office, business side of things.
Bill pay, insurances.
All of the fun
my
little
gosh,
things.
so much stuff. So glad that I have her.
Yes, we wouldn't be able to do it without each other, but that was kind of my journey. So I am passionate about this field. I am, which is why obviously I'm here, and that we do this together. But anyways, that's kind of my little snippet of my journey. It was really small.
I love that. It was a short journey.
It was a short journey.
It was definitely needed. I think that this is something really important to say. I'm just going to add in some things here really fast, is that social work is a journey that's ever changing. I think ever since I've been in there, it was like, you have to complete 4,000 hours in your master's program. Oh, but wait, now we're going to cut those in half. And oh, by the way, we're going to do this. And now we've changed it to this. And now you can do this, but you can't do that. And so there's so many things. And so take this video as like, there's possibilities that things couldn't change in here, and to really go back, call your doppel, call the NSAW or whatever program you're kind of going through, so that you can kind of understand. Okay, so I have a funny thing. I was in my associate's degree, and I was getting my generals in social work, or generals, not anything social working, but just kind of generals. And I was hitting some of those social work classes and psychology classes, because I wanted to because in order to be able to put in for your bachelor's program, you have to have some key requirement classes, which was, I believe you had to have a sociology class, 2 social work classes, and 2 psychology classes. And there might have been some other ones like a math or English or whatever.
Yeah,
but those were like
development was one I had to do.
Yeah. So those were like the main ones. So I was doing those, and I found that it was really interesting, because in my pathway of figuring this out, I noticed that I don't know, it's one of those things where I was in this, I can't even remember what class. It was a communications class, another requirement probably. And they were like, hey, you need to go and interview somebody in the field and have a conversation with them. So I was like, I'm legit going to do this, because I really want to make sure that I'm in the right area. So I called up this family friend of mine, and I was like, hey, can I interview you for school? I really want to do what you do, and I think that this would be awesome field for me. And he was so nice, and he's like, sure, come on in. I brought him a little treat. I was really excited about it. And so I went in there to interview him, and I was like, okay, tell me what it takes to be a psychologist. And he was like, I'm not a psychologist, Brandy.
Oh, what was he?
He was a social worker. But I knew he was doing what I wanted to do. But I had no idea
that there was differences.
Yes. So now, and to be fair, I've had some really beautiful people contact me as well. And they're like, I want to talk to you as a psychologist. And I'm like, oh, sure, come on in. And then I'm like, by the way, I'm not a psychologist. So I am not the only one that does this. I am very aware of this. But it was interesting, because in talking to him, he laid it all out for me. And I was like, oh my gosh. Okay, so I'm going to lay it out for you. So those of you that are considering, you are very aware of what it is. So get out your notebook. Let's write some things down. Let's see what avenue you want to go in that's best for you.
Yes.
Okay, so we have... there is a sociology degree. That is not therapy. Okay, so, and they can do therapeutic things. There is all sorts of different realms that they work in along social realms and different things. They can even do counseling and stuff like that. So that's not the realm. I don't know much about that, so I'm kind of just going to put that out there and set it aside. Mm-hmm. There's also school counselors, okay? They can counsel, they can help out. That's a different type of counseling. We're going to set that aside. I don't know much about that, so we're going to kind of leave that there as well. But we're going to talk about therapeutic, okay? therapy, like clinical therapy. Okay, so there is a couple of realms of therapeutic or clinical therapy that you can go into. Okay, so a couple of those is, first of all, we have the social workers. That's what I've done. The realm of social work, and there's going to be somebody out there that's listening to this that's going to be like, and they can do this, and they can do that. But I see it as more as advocating, very aware of helping that person get the things and the resources that they need to be able to function in daily life. You need a job. You need certain resources. We are trained in all of that. We're also trained in, if you get into your master's program, we're also trained on helping, like, not just caseload or cases and working through like those kind of situations, but we also can do therapy. So if you get your master's in social work, you can become a therapist. It's a clinical therapist, okay? So you can actually do clinical therapy. The other route that you can go into is mental health counseling. And so that's going to be like a CMHC, I think it is the final like pathway on that.
Clinical mental health counselor.
Yes. And so that is the same thing. So you can go in and get your master's in clinical mental health counseling. And that both the social worker and the clinical mental health counseling, they can kind of see the same type of people. They can do kind of the same thing. They're more specialized in, their schooling tends to be centered around more mental health. Now, with me as a social worker, I was specialized in mental health counseling because when I went to the U, which is the University of Utah, we got to choose which route we wanted to go down. And so our specialty, you could choose children welfare. You could choose drug addictions, or you can choose like the law system you could also choose, there was a bunch of different ones like women's studies, I think, or anyway. And so I went down the clinical, I wanted to do the more mental health. So I chose mental health. There was also geriatrics, which I found was really interesting.
Yeah, that's interesting.
So that's my focus. So I took intensive classes to learn mental health skills. So in that, those are the two. So we have social workers and we have the CMHCs, which is the clinical mental health counseling. And then we also have marriage and family therapists, MFTs. Yep. Okay, so their schooling is more centered around marriage and family and therapy. So between those three, we can pretty much interchange and do anything within the same field. It's pretty much the same field. Now, there is talk that psychologists, so if you get a master's in psychologist, there is talk that they're going to give like a clinical mental health counseling for psychologists in like their master's program. So just be aware, up and coming soon. I think that is awesome, and I hope that they join our field. Yeah. And so as of right now, you have to get a doctorate and then you become a psychologist, and they can do clinical counseling, but they can also do testing to find out more diagnoses and get more dive into the depths of it. So with the CMHC, marriage and family therapists and social workers, we can all diagnose. There are certain things that we cannot or should not diagnose. And so with that, we like to send a lot of things like autism, like ADHD, things like that really should be sent over to a psychologist to be diagnosed. And so they just do in-depth diagnoses. It's just a better plan. And that's why I like sending them. So that's kind of a realm. Now, above that is what's called a psychiatrist. Now, a psychiatrist is someone who goes to medical school and they get their doctorate degree. And then they're like, hey, by the way, I want to center and be more informed in mental health. And so they go back, they get like a little bit of extra training around mental health, and they get their psychiatry degree. Now, you're going to see a lot of like PAs that are PA in psychiatry, but that doesn't mean that they're psychiatrists. So let's kind of be aware of that. Psychiatrists also can do testing, which is awesome. I don't know a ton about psychologists and psychiatry other than kind of what I told you. Someone else will be like, I know so much more, and they're gonna,
or you're wrong,
And so, but that was kind of
do your own research.
Do your own research. But I'm just kind of giving you an idea of how this works, so you don't make the same mistake as I do. So that's kind of how this works. Is if you want to be an actual clinical therapist, you sit in an office, you talk with people, you help them with their problems, you do clinical actual working with modalities and interventions in the office, then that's the route you're going to want to go is social work, CMH. Oh, geez, Logan.
CMHC.
Thank you. And MFT, marriage and family therapist. Those are the routes you'll go. And maybe even soon coming psychology.
Yeah, which I feel like they're always changing. So there's always something new, or even a lot of our clinicians are like, oh, yeah, that's not the same anymore. Like, it's different. It's changing. The hours are different. And so lots of research, I guess. So please, and this may change. You may watch this in 5 years, and we may totally be completely wrong because it may be totally different.
So this year is 2025, just a word. The other thing I want to add in there is coaching. Oh, yes. Coaching is something that is definitely part of our field. It's more of goal setting. It's more of changing thought patterns, moving towards the future, redirecting, patterns, that sort of a thing. Therapy is more about looking into the past. So we're going to heal the past in order to fix the reason why we're doing the things that we're doing moving forward. So a lot of times we get stuck, or we have elements that kind of get in the way. And so we have to look in the past and say, whoa, did you know that you're doing that thing because of this back here? Let's heal this. Let's seal up that wound. Let's work on that attachment. And now moving forward, that's going to automatically redirect some of your things, which is why sometimes coaching is really hard because it doesn't have those elements of healing. But sometimes it can be a great Band-Aid for in the moment to get us through whatever situation that we're getting through. So if you're one of those people, that's kind of like how you're aware of what coaching versus therapy is.
Yeah.
Okay. All right. So now let's move into the next part. So here's some of the qualities. What do you think some of the qualities are as becoming a therapist?
I would definitely think the biggest one, at least for us, as like when we're interviewing, when we're looking for people, we're wanting someone that who is what's the word? Like they're not stuck in their ways, they're willing to learn, to adapt. Right. Also, I think a huge quality is being able to help the client where they are at, not being able to put your beliefs, your belief centers or whatever are on the client. You're looking and helping the client from where they're at. So if you can help yourself stay neutral on politics, like religious beliefs, like all of these other things, any opinion really, like then you're going to be and help them where they are at and help what's best for them, then you're going to be a great therapist.
Otherwise it can be really harmful.
Yes.
If you can't sit in that situation and be with them according to their own belief system or from their side of the couch, whatever side they might be sitting on, then it can be really harmful as a therapist to step into their world and try to redirect them into a different way that is not their core beliefs, or not necessarily their core beliefs, but isn't their part of their pathway that they're going down on, of recognizing like their their morals and standards and those core belief systems that they have as far as like integrating issues and all sorts of things that are kind of coming up. The last thing we need someone to come in and tell us that your religion is wrong and the way that you believe and your experiences are wrong. And so this is where we have to meet somebody with empathy, with like a deeper empathetic viewpoint.
Or even if their situation, like let's say you're divorced and you're working with a client who's wanting to get a divorce, if you're like, no, your life's going to be so much better if you divorce them and if you like get rid of them out of your life, like maybe that was best for you, but that's totally putting that like onto them. Like you're supposed to ask the questions and like help find them where they are at and what they're wanting and go from there. Right? Or what else you have to add on that?
What else they need.
Like
it could be super harmful for them to stay in that relationship.
Maybe they just needed communication skills, but if you're not providing that resource for them.
So let's add in the communication. Let's work on some of the abusive patterns that could be there, maybe even on both sides of the relationship. Let's work on finding ways to be able to create a beautiful, harmonious relationship. And if we can do that, then perfect, then we don't need to. But there are some times when, it can be really harmful to stay in a relationship with another person. And that's when we have to ask questions. And I'll be honest with you, sometimes I have to sit with them in that. And I have to say, okay, this is something that we really is not a healthy scenario for you in this relationship. So what is it that you want to do? Like, you might have to have radical acceptance in this if you're not willing to change or to move or to redirect or have that hard conversation, right? And so being able to have different perspectives of how to navigate this and move on can be really good. So yes, a deeper empathetic perspective is very needed when you're like in therapy. Yeah. Which I think is really good. I kind of feel like we have to, don't you feel like we also kind of have to have a little bit of self-confidence as therapists?
Oh, yes. Yes.
Like, I feel like in order to help heal people, there's a lot of times where someone might call me out and be like, actually, no, I don't feel that way. Yeah. And I have to be like, really interesting. Tell me a little bit about that. I can see that for you. Okay, let's like go with that instead of being like a little bit butthurt about, you know, someone calling you out on your ideas of how to work on therapy.
Or especially if you're an intern, you know, how if you feel very insecure about your like techniques, which is it's inevitable, right? Everyone's going to have like that imposter syndrome, but if you present yourself in a way that isn't that confident therapist that they're looking for, they are going to believe that you're not going to be able to help them, whether you are or not, right? Like you have to present yourself in a way that, you know, you believe in yourself so that they can believe in you believing in them, if that makes sense.
Which is a lot harder for younger like clinicians.
Yes.
Because I have found that in my practice when I get these younger clinicians and they'll get these older clients that come in and they have to like hold themselves higher and they've got to sit up and they've got to like here's what we know and here's like educational therapeutic practices that are going to be beneficial for your work, and they have to be more apt to integrating like evidence-based practices, right? And so then that way, but if you come in and you're like Logan said, where you're like, I don't know, like that sounds good. Like it's just, you have to firm voice state it. So, which we will have a podcast on that. So you'll want to watch for that coming soon, because that's going to be a really big one that I think a lot of people deal with on how to handle being a younger therapist or a new therapist and how to go about that in a healthy way that's going to be beneficial for your practice and for your clientele. So coming soon. Other qualities. Do you feel like there's any other qualities that you can think of ones that we look for if you're trying to decide to go into the therapeutic world?
That's a good question.
It is a good question. Yep.
I'm not sure. I think those are my biggest ones that I can think of.
I think so too. I think the one that I'm kind of looking at as well is like the ability to let things go.
Yes.
Like, there's times when I get people that fall off my schedule for no reason at all. I've been working with them for years, and all of a sudden, like, bam, they're off my schedule. And I'm like, where the heck? What happened? Do they not like me? I'm running through all of my thought patterns about the before to see like what kind of happened in this situation. Was it something I said? Like, and so those kind of things kind of come up, and I think we have to let those go. They sting for about 2 weeks. Like, I'll even put it on my calendar. Like, okay, 2 weeks. Like, here's your due date of when this is probably gonna finally like let go of some of that hurt and that butt feelings that that you just don't love, the fact that rejection, I think.
Well, and especially if they do call and they're like, oh, it just wasn't a good fit. You know, like for you as a therapist, you're not going to be everyone's cup of tea. And it's supposed to be that way. Because then otherwise, if you're everyone's cup of tea, you're not going to super connect with specific people, you know? And so you just have to find and build your schedule of of your people, right? And so like it's going to take a while to like, you know, filter through, and people are going to drop off your schedule for different reasons, for here and there, whether it's their personal things happening in their life or whether it is just fit wise, but like you're just not going to be you're not going to be everyone's cup of tea, is what it is.
I think one of the other things that is really important is you have to be a listener. Yeah. Like, I can't walk into every single one of my clients and be like, listen to me. Yeah. Like, that can be super annoying for a lot of the clients because they need to be able to speak and say the things that they're struggling with. And so you need to be a listener first. and an educator second or an investigator second, right? And so I think that's one of the qualities of working on, and that can be taught.
Yeah.
It just is nice if it comes like second nature or easier.
Right, which you'll like learn in school too. But also like you want, with those, the listening comes with skills, you know, the eye contact, the body language, like really making, like, you know, giving back that, what's it called? Like what, you know, re-saying what they've said.
Yeah, the mirroring.
And so there's a lot of skills. Like, I feel like a lot of people are like, oh yeah, I'm a good listener, but are you really? You know, and so school can teach you, but I think that could be a whole other podcast episode.
Right,
is like the cues on how to be a good listener and for how to make and help your clients to really feel loved by you and really cared by you.
And heard.
Yeah.
That is a beautiful component. I love that. With many other things, I think you're probably even thinking like they need to have these type of things as well. And that is true.
Yes.
Being a therapist is very multifaceted. And so it is a great component to start working on some of those things. Listening first, speaking second. It's not about you. It's about them. It's not about your experiences. It's about their experiences. If your experiences work with their experiences, then great. But if it doesn't, then
don't take the whole session to share your experience and thoughts that it'll help them.
But it also can be used at the very beginning for a 30-second little blip.
Yep.
When they come in and they're like, how are you? And you're like, I'm doing great. Let's sit down and talk. Instead, I have found it very beneficial to be like, oh, I'm doing so good. I just, hung out with my mom this weekend and we did some great things. What did you do with your mom this weekend? You know, so like little things like that can be really connecting and make them feel like personal.
It was
special.
Mother's Day, so that's why.
Hanging out with the moms.
Bringing up the moms,
Yep. Anyway, okay, so with all of this, these are some of the key components to getting in and being like, do I have what it takes to be a therapist? And those are some of the ones that we're really looking for, is the ability to really step beyond yourself and see someone else. And if you can do that, then yes. And then this gets us into the part of like, okay, so we get through the associate's degree. You're going to apply for your bachelor's. You may not even have to have your associates to get your bachelor's, right? I didn't. I got my associate's degree while I was in my bachelor's program. Yeah. So those are some things to think about. Let's talk about bachelor's program, because I think that this is really interesting. Some people are like, well, I have none of the required classes for a bachelor's program to get into a bachelor's program. Okay, well, let's take a couple of those classes. You know, you haven't done any psychology, you haven't done any social work, no big deal. Let's take some. If you want to go to a prestigious college.
Yeah.
If not, there's places like Liberty or Grand Canyon University or Kentucky. Or a couple of other places where you don't even have, I think one of my therapists, she has a bachelor's in, what was it called? I think it was like acting.
Like performance or something.
Yeah. And she went in, she's like, I want to be a therapist now. And so she went in, she got into Grand Canyon University, and she's now just graduated with her master's in social work. And yes, did she have to take a couple extra classes? Yes, but they just started her right off in the master's program, and they integrated some of those key component classes that you need into their program. So if you're not going to go, if you don't have your heart set on like a big high-end university, then some places like those can get you right in the door
those are all
and get
online.
going. Yeah. And it's been like, what, 2 years? I think she took a 2-year class, and it was an online course. So that's the thing. Let's talk a little bit about bachelor's. What's the difference between a bachelor's internship versus like a master's internship? You want to talk a little bit about bachelor's?
Yeah. So bachelor's, what this looks like is you're able to sit in sessions, you're able to educate, you still can't diagnose.
Right.
But you're able to sit in on sessions. Most bachelor's internships, at least for like what it looks like for with us, is we do a lot of presentations, classes. This could also be help with, social media, front office, answering emails, putting together resources. That's what it looks like a lot for us. I don't know about for other places. Like, I know there's a lot of inpatient places that, bachelors are great.
I did my bachelor's in an inpatient treatment center with teenage kids, and I was not allowed to lead a group. As far as like by myself, I had to have another person that was like an LCSW or a marriage and family therapist or someone else that had to run the group with me. But I could sit in the sinew and like talk with the kids, and I could do a lot of education work. I couldn't meet with anybody by myself. It had to always be with another person. Where the difference with a master's level is you can run those groups. And not to say that bachelors can't. They can run that group.
Specific groups, right?
Yes.
Yeah, there's specific different things that you can do.
Yes, specific groups. And so, but master's levels can run like more clinical groups. They can run the groups by themselves. They can sit with a client and do individual therapy. They can do, if I have like a master's level in with me, they can like do all sorts of integrative work, where a bachelor's is a little bit more quiet because they can only do educational. And so like they can add in all sorts of concepts of therapy and lead discussions inside where, you know.
Yeah, and I know with bachelors too, there's a lot of call centers that you could do, like answering suicide hotlines.
Right.
Like there's so many different resources that way. I know I was looking into those type of options for when I was in my bachelor's. But there's so many different call lines now.
Right.
Because like hotlines. And so those are options as well, which those for the most part are remote. If you need something more of a remote internship, those could be some options too.
Some of my favorite questions that were asked to me in my bachelor's and master's when I'm trying to get people to come into my office to do it, I love it when they ask me, what type of education will you be providing me? Because that makes me go, whoa, hold on just a second. They're very interested in education. They want to learn. They want to grow. They want to be better at their job. And that's a really great question when people ask that. I'm like, they have it. They know, they see. Or what are your worries and concerns about getting a certain kind of intern or here at your place? Like, that's a good question to ask too, that I've noticed is really good. So those are kind of some of the things that kind of lead you down this pathway to say, ooh, okay, I'm going to have to do an internship, right? So I think like most internships for bachelors is about 15 hours a week. They run a couple of months, not necessarily anything big. I think mine started in January, went to May. And so you're just going to do a little tiny one. According to master's programs, that's going to be a little bit different. So depending on the master's class that you go to will determine which type of work that you can go through. I think like Liberty, and I'm not sure on this, but I think a couple of them, you have to do like observation hours for the first part of your internship in your master's program. And then the last part of your master's program, like that second year in your master's program, is going to be more about like clinical work. And so that's something to be aware of when you're like researching your places that you're going. I know that some of them like Grand Canyon University, even like the University of Utah intensive program, like if you get into an intensive program where it's only like a year program, or other places, you can dive right in and start therapy like right away, like doing actual therapy. Now for us at Bluebee, we require a certain amount of observation hours. You have to put together a class first. Like all of those kind of things have to kind of happen before you get your internship hours as like direct clinical care for individuals, for yourself.
Yeah.
But you'll be observing inside our offices until that gets done. And so those are just some things to kind of look at, be made aware of, so that you don't jump into a schooling and be like, oh my gosh, I can't even do therapy for the first year. And that's hard because some people are like, I need to make money.
Yeah. And
we don't make money unless you see your client. So that's something to kind of be aware of as far as like mastership.
Well, and that's a good point too, is for bachelors, I would say like most internships, especially for bachelors, are unpaid.
Right.
And so, like, to think about that too, you know, like that it's going to be all service hours, basically.
Right.
Like
15 hours a week.
Yeah.
18-ish.
Yeah. And so to plan for that. And so for masters, they're opening it up where more are becoming more paid.
Right.
But yeah, for us, like, you don't get paid you get paid per client seen. And so if you're not able to see clients for your internship or whatever the case is, like, just to be aware of that as well.
Yes, that's important to know. And it's also important to know that, like, sometimes with the bachelor's or with the master's program, that the hours are going to look a little bit different. So with your bachelor's program, you might have to do like 15 hours, depending on the school. That's something you also want to look at. But with your master's, you might have to do 18 to 20. So that's going to be a difficult. Now, if you're going in person, let's say you're going to the U or wherever you might be located at, like a higher university that's in, you have to go into class. They have classes that are only available on certain days. So like their bachelor's program, I think is like, you can go in on Wednesday and Thursday, and their master's program is only on like Thursday and Fridays. Yeah. So that was something that I was not aware of.
Yeah.
So that I could be like, whoa, I had no idea that their master programs are only classes are mostly on Fridays. Like, that changes the dynamic of like your home life for sure.
Yeah, when finding an internship. Like for us at Bluebee, we would only be looking, if we are looking for interns, it would only be for Fridays, right? And so like for those schools where the classes are in person on Fridays, like that wouldn't work. And so like to be aware of that as well before you get an internship.
Right. Those are some great questions. Okay, so here we are. You finally made it to your master's program, and we're super excited that you're here. Yay! You're graduating.
Yay.
Things are going great. You love your practice or the place that you've been working at. They offer you a position. This is awesome, which, by the way, most places don't. So don't be sad about that if you don't. But you are going to want to start looking into that like a couple months before you graduate.
Yeah.
And so now you've graduated. Well, this is where it all goes up in flames because we don't know. I'm going to tell you why. Because what this means is you've got to find a supervised clinician to take over supervisions for you. Now that you're
a supervisor,
yes. So now you have to get that, which is great. And you also have to start finding a place to work. If you didn't get an onboarding packet from the place that you were at before, right? And so that can be kind of heavy. So start looking into that. A couple of things that's really interesting is that I say that this all blows up right now because this is a lot of where we don't know what's happening inside our world right now. They're in such a need for social workers and for clinical therapists that they are changing like super fast. It used to be where we would take the clinical exam right after we got done with school. And now they're saying that you have to take the master's and then you take the clinical when you right before you take right after you get all your hours, and then you take your clinical. We don't know. So we're just going to leave this up and say, you know what, check into your place at this time right now. It looks like you take your master's exam right after you're done with schooling within that year point or 6 month point. And then once you get all your hours in, which is about 4,000 hours, so that's roughly about 2.5 years to 3 years part-time, which is 20 hours a week, to 2 years if you, like 1.5, 2 years if you do full-time, which is usually full-time is about 30 hours.
Yeah.
So just so you know, in our industry, because it's so intense.
Yes.
And so just so you're kind of aware of that, that's what that looks like. And then once you get your hours, then you're going to go take your clinical exam. And the clinical exam, you're going to want to make sure that you test on it. There is a little bit of a fun thing that's coming up. I don't know if you've heard about this, Logan, but they are thinking about passing possibility of that if you take your clinical exam so many times, then, or even once, I'm not sure what it is. And someone on here will be like, I don't know what that is. But you can just like do an extra 1,000 hours, I think, or 500. I think it might be 500 hours. Yeah.
Oh, yeah.
So you don't have to like actually pass the exam.
Interesting.
Isn't that interesting? Huh. So to be continued.
Right.
Don't know. That is something to be aware of, researching into that and finding out. A couple of things that I just want you to make sure of. Number one is an LCSW is awesome. The reason why LCSWs are great is they have the experience, they're done with schooling, and a lot of insurances only allow not a lot, but some insurances only allow LCSWs to be paneled under them, and no supervised clinicians can take clients. So, like, what is that? United Healthcare, I think
United Healthcare has been the big one we've ran into.
And so those are just some things to be aware of if you're coming across that you're not going to be able to see every insurance as a supervised clinician. And so that's why we're so excited when someone gets to be an LCSW, because it's like, yay! But that's kind of some things. Also, a couple of things that you might want to just notate. You're in school. A lot of times you're going to want to look into, make sure that your schooling pays for your insurance, your malpractice insurance. If not, and you have this breach of like a couple of like months in between where like you still want to do continual care with clients, but insurance isn't covered by the school, that's something that you will want to make sure that you pick up
for like the summer or like whatever the case is.
Or even while you're, let's say, transitioning over to a new place, you're going to want to make sure that either your place picks up your malpractice insurance right after graduation, or you have that set in stone ready to go. A couple of things just to notate as far as like graduation goes. A couple of things that you're going to want to put on your to-do list, which is really super important, is you're going to want to reach out to Doppel. You're going to want to have, when you sign your paperwork for your diploma at your school, you're going to want to make sure some schools will directly send your diploma, like a copy of your diploma, to Doppel or whatever state you might be in that kind of takes that. And so you're going to want to do that. And then you're going to have to fill out an application for Doppel, and you're going to want to turn in, there's like a supervisory report that you're going to want to turn in that says, this is my supervisor, and she signs it, or he, and says, I'm the supervisor of this person, because they will not give you your CSW or whatever license until that happens. Yeah. So that is something that you want to do immediate. We're like, before you even graduate, you have those papers in the Doppel. And so that's the way that this goes. No questions asked. And you have insurance that is sent over to me that starts that day. Yeah. Yep. Malpractice insurance. Anything else we have here? We feel like it's important that they should know.
I don't know. That's like for the CSW for when you graduate your master's, but we could jump into like LCSW. There is a difference for when you're licensed and then when you're able to supervise CSWs. Oh, there is so true. You have to be licensed. You have to be an LCSW for 2 years before you can supervise CSWs. You can supervise interns, but in order to supervise CSWs, you do have to be licensed for 2 years. Yep. So to keep that in mind as well.
Yep, that's really good. Yeah. And they are coming up with a new thing for supervisors that they are about to put forth, and I think it happens in 2027 to be aware of, is that you have to have so many, classes. You have to have CEUs on it if you're a supervised clinician. I think you have to have two.
Yeah, because once you graduate, you get to be responsible over those too.
Yay!
Whole world of new responsibilities.
Yay! So we're so excited. If you want to go on this pathway with us, we're super excited for all people who want to become LCSWs or CSWs or any sort of clinical therapeutic journey. Join us. It's so needed. Yes. We don't have enough of us. And so, but we just want to thank you for joining us here at Blue Bee Counseling Services Therapist Table Talk, our new episode. We're super excited about our classes that are going to help you learn a little bit more integrative work on how to do therapy with your clients. Being a newbie therapist, or maybe you're an old bee. That's okay. We'll take old bees.
We'll take old bees.
Old bees, newbies. You want to learn something new? I'm all about it. Yes. So come with us on this journey. We're super excited to have you here. And until next time, thank you for joining us here at Newbie Therapy, Therapist Table Talk at Blue Bee Counseling.